Okay, Chapter 7 is called The Assessment of Conversational Fluency and Communication Difficulties. In this chapter, we'll talk about ways to formally and informally assess conversational fluency. And almost every oral rehab training program should have some aspect of conversational fluency assessment. And usually it's done at the beginning and at the end to evaluate the effectiveness of the program. Okay. The initial assessment will help guide what measures are used. And then the final assessment obviously will help determine if it was successful. So here are some goals. You can take a look at them. So identify some of the communication difficulties, what situations they occur, in which they occur, what individuals they occur most frequently with. Assess conversational fluency, determine the communication demands placed on the patient every day. The other day when we talked about case history information, if you are working with somebody in an AR setting, they wear hearing aids, they have a cochlear implant, determining listening needs is extremely important. So once you do the case history, you test, you counsel, you talk about hearing aids, they decide to get hearing aids, that's when you need to get a little more in-depth into what their listening demands are. And again, document the kinds of social activities, assess how effectively they use communication strategies in those settings, and then chronicle and get any information about their employment responsibilities. So here's an example of high conversational fluency. It's characterized by minimal communication breakdowns, easily exchanged ideas, no dominance in terms of speaking, and then there's minimal silence. One thing that I always bring up when we talk about silence, we talk about it in the counseling course in audiology graduate school. Silence is okay. Now we're talking about reasonable amounts of silence. So if you're having, conversation with somebody, I think most of us, myself included, particularly in, let's say, newer relationships, newer friendships, what have you, silence is uncomfortable for people. And so I think it's important that as a clinician in the environment that you have to learn to be okay with silence, particularly if you're giving, let's say you're counseling a parent about their child who is 6 months old and you've just detected they have profound loss. You have to learn to be comfortable with silence. Okay. Just always keep that in mind. Low conversational fluency, lots of communication breakdowns, one person dominates, there's silence, excuse me, but it's awkward silence. It's not silence that kind of flows with the conversation. Now, one way to gauge conversational fluency in this turn-taking, in the sharing of speaking time, is what we call the mean length of speaking turn. Okay, and it's the average words spoken during each speaker's turn. And there's a ratio you can use for that as well. So here's an example of high conversational fluency. Let's go ahead and just take a look. Has your new furniture arrived yet? Yes, and I'm thrilled with it. You said it was going to be French Regency. No, I didn't go with that. My husband wanted a deco look, right? So Joan had 8 words. Okay, 16 words divided by 2 utterances. Anne had 9 words, right? 18. So you had a 0.9 MLT ratio where it was about equal, okay, in terms of speaking. Now here's an example of low fluency. So I'm not going to read that for you, but Martha's MLT, 17 words divided by 3 utterances, so 5.6. Tom had 0.7. So the ratio was 6.2, and so Martha did most of the talking in that example. Okay, and you can do this in a clinical setting, right? It's not as ecological, right? It's not as natural, but you can use this MLT ratio. So these are some considerations for evaluations. May require many measures to appropriately evaluate, and there's no one way to evaluate conversational fluency. So it's really individually driven. Some people might be in certain situations where they need to be evaluated. Others may never be in that situation. And again, it's not ecological, so the person might experience a lot of problems out in the real world, but less in the clinic, and that's just what you expect. Here are some ways that you can measure conversational fluency. The interview, you can do so via questionnaires, daily logs, group discussion, and then unstructured communication interactions. So the daily log, I feel like, is an important one for people who wear hearing aids. We ask them to, when they first get hearing aids, or even if they've had them for a while, we ask them to keep a log of situations in which they struggle. And so a lot of hearing aid patients or cochlear implant patients are used to taking a log. And each one of these has their own pros and cons, which we'll talk about. The unstructured communication interactions, I mean, it's closest to what they will get in the real world, but again, it's in a clinic, right? Unless you can somehow observe them in their real world environments. So here's some information about the interview. You want to get information, subjective responses regarding the breakdowns, and informally elicit specific information. Are you able to use telephone? Tell me about your listening difficulties. I am one, when I do case history, and I bring this up in intro to audiology all the time. What do I say when you take a case history? If you ask somebody, okay, Mr. Smith, what brings you in today? They'll probably give you about 70% of what you need, right? There's a reason why they're there. They'll give you that information. Now, you may have to probe a little deeper in some questions, but going about a case history in that way, it's open-ended. It allows them to give you information, and most of the time you'll get the vast majority of information you need. So that's how I like to do interviews or case histories. Now, you'll need to, if there are specific components you need to ask about, then obviously you go deeper with that. The interviewee must be a good listener, attentive, non-judgmental, encouraging of conversation, and committed to help individuals. Encouraging that conversation is important. That helps you kind of give you a gauge of how they communicate. Questionnaires are okay. They can help provide the clinician with kind of a baseline, and then can help guide questions, more specific details about their situations. Open-ended questions elicit qualitative data. Closed-ended questions, I mean, I like open-ended questions. There are some open-ended surveys which I want you to look at. We will talk about them, but one of them is the Client-Oriented Scale of Improvement, the COSI. Okay, the Client-Oriented Scale of Improvement. So if you Google this, they'll come up because a lot of the hearing aid manufacturers have remade them. These are used pre and post hearing aid fittings to help the audiologist determine the situations in which the patient needs the most help. Okay, not really communication breakdown stuff, but a scale that's used commonly in audiology. The HHIE is another one, which is right here. That's mentioned here. Hearing handicap inventory for the elderly. These are some specific yes, no, sometimes questions. You can take a look. But questionnaires are pretty helpful overall. Daily logs. This gives you often more qualitative data, although sometimes you get folks who come in and say, yeah, and I had 6 or 8 communication breakdowns in this particular situation, and they were all when so-and-so was talking. And so daily logs can give specific information. It just depends on how you train the individual to log everything. Here's some examples. Take a look. So these are very specific, right? These are very specific situations. Group discussion is also a good way. I think the one thing about group discussion is, in my experience, you have 2 types of people, and maybe 3. You have those people who love group discussions and it makes them talk more. You have people who hate group discussions and it makes them talk less. I would say 8 out of 10 people fall into one of those 2. You might get a few people like, whatever. But a lot of people like group discussions. It helps people feel like, oh, there's other people with my issues that are experiencing the same thing. And you get some who it makes them be more reserved and say even less. Okay. Here's some common concerns that are usually brought out in group discussions. And again, for some people, it's great. It gives them an empowering feeling, right? The group discussion, right? They're able to see, oh, these other folks have the same issues I am having. You see this a lot with alcohol, different support groups for various things related to substance abuse and what have you. And I used to work at a psychiatric hospital in grad school, and as a clinical assistant, and they paid my tuition and different things, which was great. And we would be part of these groups, and you could see for a lot of folks, it really helps them open up and really is beneficial. So same thing applies here. You can do unstructured communication interactions, right? You can just watch them again. It's you can make them unstructured, but it's hard to make them realistic oftentimes in the clinic. So perhaps if you can go to one of their environments and assess this, that would be ideal. You can also do transcription analysis, right? You can measure the MLT, number of topics. There's rating scales you can use to assess this fluency. All right, so that's it for Chapter 7.